And they found that for every hour that kids are on screen, it increases the risk of nearsightedness by 21%. Research is showing that screens definitely are contributing to a lot of the symptoms that this patient experienced: the irritability, the inability to wake up in the morning, and yes, even the eye symptoms of eye fatigue, or eye strain, or redness, or dryness. Excessive screen use has been linked in kids, not just 20 minutes here and there or an hour, but a lot of hours has been linked to decreased cognitive development, a delay in speech, and even decreases in social emotional developments. So I see this scenario in clinic all the time. Let's say an 11-year-old kid comes into the office and they're complaining of eye fatigue and eye strain. Maybe even their eyes are a little bit red or they feel dry. And then the parents are worried because they're not sleeping well. They seem really groggy in the mornings. And their grades are starting to slip on top of all of this. And the parents are usually, like many of us, are just overwhelmed by all the evidence and the data and the studies out there and all the influencers telling them what to do about screen time. But in their homes, it is an absolutely huge battle, which I understand as a mom of 3. But this, of course, this isn't just an isolated story. The research is showing that screens definitely are contributing to a lot of the symptoms that this patient experienced: the irritability, the inability to wake up in the morning grogginess, the lack of good quality sleep at night, and yes, even the eye symptoms of eye fatigue, or eye strain, or redness, or dryness. So that's what we're going to be talking all about in today's episode. Hello, everyone. I am Dr. Rupa Wong, board-certified pediatric ophthalmologist, and your host for In Focus, the podcast that brings focus and clarity to your family's eye health and parenting. And this is something that, oh my gosh, the amount of minutes, hours, days, weeks that I have researched screen time, that my husband and I think about our kids' screen time, it's you would be maybe a little shocked because we live and breathe it, especially because we've got kids that are in that age range. My kids are 11, 13, and 16. They are all really heavily dependent on screens, both for their school and then, of course, for their social lives. And the data is out there. And so I always start with that. Let's start with the research. Let's start with what the data says. And then how can we actually start implementing this in our lives without a bazillion battles, and at least try to make a little bit of difference in terms of their eye health, their mental health, and their sleep. So we really saw this huge explosion of screens during the pandemic, and kids were on screens that usually would not have been. They started to develop a lot of these habits of being indoors and being on screens and not being outdoors. And now we've started to see some of the long-term consequences of this. Parents will often tell me in the exam room, like, I know that screen time's bad, but I don't really know how much I should allow my baby or my child, and I don't know how to actually draw these boundaries. So I want to address both parts of it: the science, the evidence behind screens and your kids, but also the parenting strategies that I use. I'm certainly not a parenting expert, but some of the things that we do in our home to help with these screen time battles. So first, the eyes. I'm a pediatric ophthalmologist. That's why I got interested in this topic in the first place. The eyes, vision, and screens. There is a link with near work, which is anything you do up close, and nearsightedness in children. So myopia, which is nearsightedness, is on the rise, and it's really thought to be because of a lot of these environmental lifestyle factors. If you didn't listen to my earlier episode this month, just really talking about why we're seeing so much more nearsightedness in kids and why does it matter, please listen to that. And I'll put that in the show notes. But they actually did a study. It came out just this year. It was a meta-analysis in 2025 that looked at the effect of screens on vision. And they found that for every hour that kids are on screen, it increases the risk of nearsightedness by 21%. And this wasn't just like a straight line. There's a marked increase when kids are on devices or on screens for more than 4 hours a day, a very sharp increase. It doesn't matter how old the kids are, if they are 3 or if they are 18, that holds for all age groups. And it didn't matter what kind of screen it was. And I think that's a take home, because sometimes a lot of parents wonder, are some screens worse than others? And we'll get into that. But this study looked at phones, tablets, and TV. So all different kinds of screens with all different ages of children. And they found that also the risk was even higher in those kids that weren't outdoors as much, because we know that outdoor time is protective. So if they weren't outdoors, then that risk, that odds ratio increased even more of the kids becoming nearsighted. So we really saw this, of course, during the pandemic when kids were on screens, this accelerated rise in nearsightedness and worsening of nearsightedness in kids. And then we also see a lot of digital eye fatigue. Some people will call it computer vision syndrome. It's basically the dryness, the asthenopia is the medical term for it, when the eye muscles just get tired. They get fatigued by working so hard. And we're starting to get a lot of kids with these complaints. And in addition to actual eye fatigue or blurred vision, they might complain of headaches. And it's not always the only thing that causes headaches, but it certainly can cause headaches. So it's something to be on the lookout for. And we found that digital eye strain is a lot more common in kids who are on screens, who use a phone or a tablet. And especially if they're using it during breaks, if they're just constantly on their phones when they're walking around between classes, that increases their risk of digital eye strain. And so, of course, all of these studies that look at digital eye strain in kids, they recommend getting outdoors, following the 20-20-20 rule. Every 20 minutes, look 20 feet away for 20 seconds, and then taking breaks from the screens in general. So let's just talk about the difference in screens. When you are looking at a phone versus a tablet versus a TV, phones and tablets tend to be held closer. So from an eye perspective, that's going to be worse because they are holding it closer, typically 12 inches, if not even a little closer. We want things held 18 to 24 inches away. So this is actually why TVs are a little bit better, at least in terms of nearsightedness, than a phone or a tablet, because when you are looking at a TV, it is a distance target. So it's not necessarily going to induce as much nearsightedness just in and of itself. Now, if a kid is just always on their TV at home and they're not outdoors, well, that decreased time outdoors is also going to possibly be a risk factor for nearsightedness. But just looking at the screens themselves, I tell parents, if you can, cast things onto the screen, onto the TV. So if your child really likes watching YouTube Kids, then watch it with them, of course, and cast it on the TV. So I think that that's really good for especially younger kids, and as much as possible, even for those elementary, middle school kids. Watching it on the TV is going to be better, or even on a laptop, or if they have a tablet, putting the tablet on the table and sitting 18 to 24 inches away from it, as opposed to just holding it right up here. That's going to lessen the impact on their eyes, cause less digital eye fatigue and computer vision syndrome, and less nearsightedness in the long run. Screens don't just affect the eyes. One of the really worrisome aspects of the screens, especially at bedtime, is how it affects kids' sleep. And there have been a lot of studies examining adolescent sleep patterns and their use of screens at bedtime. And what they found that it can take longer for kids to fall asleep if they use screens at bedtime. The quality of their sleep is not as good. And then they have more morning grogginess when they wake up. In addition, their sleep duration is shorter. So a lot of things that you don't want for your kids or your adolescents. My middle son sleeps until right now he's probably sleeping a good 10 to 11 hours in the summertime, and we let him. He doesn't have anywhere to go. I want him to get as much sleep as possible. It's so important. It's not just 8 to 9 hours. Obviously, for a lot of kids, if they're going through their growth spurt, they need even more sleep, and screens at bedtime just really affects that sleep quality in so many different ways. And there's a couple different reasons when they examine sleep why this happens. The first thing is called time displacement, meaning a kid is on a device, is on a screen when they should be sleeping. They are just using that device. So instead of going to bed at 9 p.m., if they are on their device in their room, they're going to bed at 11 p.m. or if they're texting their friends or whatever it is, or watching a TV show. That is what I do. We all know that, right? When you are watching Netflix, you lose track of time and you sleep later. So that's just the first thing. Their bedtime gets pushed back, just time displacement. So the second reason is psychological stimulation. So when your kids or even us are on devices, there's a lot of stimulation going on. Even if you're just texting friends. I know when my daughter's texting friends, there's gossip. Oh my gosh, I can't believe this happened. Or there might be a fight or anything like that. Or if you're watching shows that can be very exciting, car explosions, or a lot. Like, I don't watch horror shows at all because I get too into them, and I get really, really scared. So I have a lot of psychological stimulation from my Netflix shows. So I watch only certain kinds of Netflix shows, and none of them are ever horror or that kind of like psychological thrillers. I can't do that because I tend to watch a lot at bedtime, and I know that it interferes with my sleep. Same for kids, even more so. They get drawn into the show. So their body is like revved up and it should be calming down mentally and physically to prepare for sleep. So it obviously makes it more difficult. And this has been shown in studies. And then there's the physiologic effect of screens, which is so interesting because there's a link back to the eyes. The screens emit blue light, as we've all talked about. Now, in your eye, some of the oldest cells in your retina are these melanopsin cells. And what they do is they are responsible for helping send the signals to make the melatonin, which is all responsible for your circadian rhythms. And when you have blue light that you are seeing at nighttime, because blue light is typically in the sun, that blue light that's in the daytime is what gets visualized by your eyes, sends the signals, and tells your body to wake up. Sets the circadian rhythm, sets your internal time clock. But when you're getting a lot of blue light at bedtime because you're on a device, that can disrupt your natural circadian rhythms, and that causes a lot of the problems with sleep quality and morning grogginess because of that. Especially more so in adolescents versus adults. So if you feel like you're sensitive, just imagine how sensitive your kids and adolescents have been found to be even more sensitive to that blue light at night. So let's look at kids according to ages. So infants and toddlers, they are really, really, really sensitive to screens at bedtime. So I know a lot of people will use screens and it's calming, or they watch their favorite show before they go to bed. But in studies, it's been shown to cause more nighttime awakenings, and that's never something you want for your young child. Less total sleep, and even a longer time to fall asleep. And as someone that would sit there with my kid and wait until they fell asleep, and that was with no screens at all. Sometimes I would take my child like 30 minutes to an hour to fall asleep because they're so revved up and they want to talk, or they just want to play, or they just want to look at you or do all the things. You obviously want your kid to go to sleep a lot of times out of just preserving your own mental sanity, but also because it's in their best interest. So screens have been shown to interfere with all of those. And then in school-age children, it's been linked to some of the things I talked about before. Later bedtimes, shorter sleep duration, more morning grogginess. And the studies showed that cutting back on screens, even just a little bit, impacted the quality and the length of the sleep duration. And then for adolescents, the studies have shown that interactive screen use in bed significantly delayed their sleep. They had disruptions in their circadian rhythm, and it reduced their sleep duration. So they're just not sleeping for as long, especially if they're gaming or texting or doing anything where it was interactive, not just even passively watching a show. So the interactive things was associated with worse sleep. So the type and the timing of the screens really does make a very big difference, especially for adolescents. And this is what I thought was really interesting. So I do still charge my phone in my bedroom, but they've shown in studies with kids that even just having a smartphone or an iPad in the bedroom, just in the bedroom at all, can cause some serious sleep disruptions. First, because it's more portable, and so it's often going to be used in the few minutes right before or the hours right before going to sleep, which is not what we want. We want to be cutting that blue light off and not have so much psychological stimulation. And even just having the phones and the smartphones and the tablets in there, that caused less sleep, even if the kids weren't necessarily on it. They had more daytime sleepiness in studies and an increased odds of inadequate sleep. So that's going to go into what we talk about as just easy things that we can do to improve or decrease the negative consequences of screens on our kids. And then neurologically, there's so much data that's now coming out about the use of screens in especially young kids. So they've looked at kids ages, babies to age 5, and they've done all these kinds of MRI studies. And what they found is that excessive screen use, and I'm not talking just 20 minutes or an hour here and there, excessive screen use in kids has been linked to delayed language, decreased cognition. Excessive screen use has been linked in kids, not just 20 minutes here and there or an hour, but a lot of hours has been linked to decreased cognitive development, a delay in speech, and even decreases in social emotional development. So that's, to me, was one of the most interesting findings, is that it's been linked now to a lot of attentional issues as well. And when they look at these longitudinal studies, there's a lot of concern, because if kids are exposed to a lot excessive screen use when they're very young, again, it's also been linked to lower IQ scores, poorer working memory, and these higher rates of social emotional difficulties at school. So, they just have more difficulty holding in their temper, or they're more volatile or irritable. And that's all been shown in these studies. Now, there's a lot of data that's coming out, so we really have to see. But again, this is with excessive screen use, not just a little bit of screen time. So what they've done is they've done these neurophysiologic studies in infants when babies were exposed to screen time, and it's been linked to poor attentional control. So it lights up in these areas where you should have a little bit more control. And in these babies that are exposed to screens, they found that those areas were lighting up more. And so that then produces later challenges in life, right? So that can present as ADHD or some of these other neurodivergent types of diagnoses. And so with brain development, as with anything with kids, the earlier that screens are started, the more frequent, or the number of hours that babies or toddlers are using it, the worse. And then we see worse types of sequelae and complications from it in all of those different types of areas. So this is really dose dependent. So more screen time is going to equal a greater risk. But here's where content really matters. So if you're just passively consuming something, if your child is just watching something, that is actually associated with worse attention and issues down the road. If you are co-viewing with your child, co-viewing means you sit with your child on the couch, you're watching something on TV, and as a little cartoon sheep goes, oh, what noise does that sheep make? That's co-viewing, because you're interacting with your child, and then it's going from something that's passive to something that's a little bit more active. And that's going to then help continue to facilitate the language development centers, the cognitive development. The problem occurs neurologically when kids are just passively given an iPad and they're just watching, because there's nothing that's required of them to give back. Versus, if an adult is talking to them, there's so much richness and complexity that comes from that the brain really needs as a baby, as an infant, as a toddler, for development. And so that's what screens are replacing. And so at least if you're co-viewing a screen with a child, then it's going to minimize some of those negative effects. So I wanted to break down a couple myths and misconceptions about screens. First myth: all screen time is equally harmful. And that's not necessarily the case. The context really matters. Like I mentioned, co-viewing is going to make a screen then something educational versus passive consumption. The content of what you're watching, the parental involvement, if it is an educational show, all of that's going to make a difference. Second myth: only being close to the screen, that's the only thing that matters. And clearly that's not. Prolonged use of screens, that makes a difference no matter what, for behavioral and even vision and neurologic and physically too, creating a more sedentary type lifestyle, which I didn't even really talk about any of the risks of obesity and weight gain and mental health and screens. We're really just focusing on the neurologic and the eyes, since the eyes and the brains are related. But there's a lot of different ways that screens affect kids, and young kids and older ones too. And it's not just how close you sit to the TV. Third myth, bedtime content is fine as long as it's calming. No, that's also not true. As we've talked about, the blue light from bedtime video watching really can disrupt sleep, and it's been shown in numerous studies from kids all the way to adolescents. Only older children are at risk. Nope. Younger kids are more vulnerable. So the amount of screen use that a younger kid gets, the number of hours, all of that is actually going to affect them more than older kids. Educational content is always beneficial. And this is where I get a little bit of pushback from people. I know there are some really beloved shows on YouTube, on PBS that are really educational. However, too much of anything is never going to be great. And if it's watched at bedtime, again, it still causes a lot of the issues that I discussed before. So here's the evidence-based guidelines. Younger than 18 months, no screen time at all. That's the recommendation by the American Academy of Pediatrics and the American Association of Pediatric Ophthalmology and Strabismus. None, except for video talking, meaning like FaceTiming or Zooming with like grandparents that are across the country, which we do a lot of. That's fine because, again, it's interactive. It's like talking to someone. So at least neurologically, that's all right. But otherwise, yes, even that educational content that you love so much, that favorite show, if they are younger than 18 months, we're going to say no. 18 to 24 months, you can start watching just really high quality programming and you're co-viewing it with them. That's the rec. And then 2 to 5 years of age, just 1 hour a day. And that's really going back to that earlier study of nearsightedness I mentioned. An hour seems to be about the safe threshold, which doesn't profoundly increase the risk of nearsightedness. So from age 2 to 5, 1 hour a day. And then age 6 and above, this is when you really want to sit down with your kid and start to develop some kind of screen time agreement. I have one. I'll link it in the show notes. It's a fillable PDF. It's based on the American Academy of Pediatrics Family Media Plan. It also details all of these guidelines about how much screen time your child should have at various ages. It's got that as well. But what it has is a resource that you can sit down with your child and you fill it out together. You make a screen time agreement. He signs it, you sign it. And you decide what's important to you. So in our house, we have this for our kids, no screens in their rooms. They are not allowed to charge their phones. They do not have computers in their room. They are not allowed to have their iPads in their room. No screens in their rooms at all. It just needs to be there. Now, they can sit here in our family room if they want a little privacy because this part of the house is tucked away a little bit. If my son wants to FaceTime with his friends or whatever it is that they want to do, but no screens in their room. No screens at the dinner table or any meal. So that's just not face down on the dining table, like not at all. It's just, that's one of our family rules as well. So you have to decide what the rules are. What time do screens get shut off in our house for the older kids? For my middle schooler, he's 13, so it's 9 p.m., which he hates. He says his friends go till 11, but I know the implication of going past 9 p.m. If I'm trying to get him to get to sleep by 10 p.m. because he's got to wake up by 6 a.m., that's just not going to happen. So that's our rule, is the Wi-Fi actually gets shut off for all the devices at 9 p.m. So they don't love it, especially if they're gaming or doing something. Now, if they are working on homework and they need that extra time, then of course we extend it. But overall, that's what we say. Recreational screen time use done by 9 p.m. And those are just kind of some of the smaller ways that we start to get a handle a little bit on screen time and be able to support their sleep and their well-being. Because what they've shown in all of these studies is that excessive screen use has been linked to so many outcomes that we don't want for our children. Persistent deficits in cognitive development and language development and social emotional development, which is equally as important, chronic sleep disturbances, and even behavioral problems. So that's all been linked to excessive screen use, especially at a younger age. And this is dose dependent. So an hour seems to be reasonably okay, but even 1 to 2 hours every single day can be linked to this in a young enough child. So it might seem excessive, it might seem strict, but we are seeing the research. We are seeing the way that these infants, even their toddler brains, are lighting up in various areas that we don't want. So really, I just recommend very strict limits, especially in early childhood. That is the key. As your kids get older, elementary school, middle school, high schooler, then there needs to be discussion. But very early on, you want to be really strict about this because it can impact them lifelong. And this is something I just wanted to finish with. We're not powerless. As parents, we definitely have a lot of power in the way that our kids consume their screen time. Sometimes I feel like I don't have power. Like, oh my gosh, this kid is asking for more screen time and he's complaining because his friends are always on it, or she's saying that her friends get to text late into the night. She feels left out. But we have to make these appropriate choices for our children. And there's a lot of scientific evidence there that shows that screens affect the eyes and the brain and their sleep. And we need to safeguard that. That's it for today's episode. I hope you found this information helpful. If you liked it, please share the episode with a friend. And don't forget to rate and review the podcast. Until next time, I'm Dr. Rupa. Bye for now. Thanks for joining me on In Focus. If you found today's episode helpful, I'd love for you to share it with a friend, leave a review, or hit that subscribe button so you never miss an episode. For more tips on eye health, parenting, and staying focused in a busy world, follow me on Instagram at Dr. Rupa Wong or head to drrupawong.com. Until next time, keep your vision clear, your priorities focused, and your family thriving.